Now, when we get into the discussion of the ascending tracts, we must know, and we even went through the facts, that different primitive as well as evolved stimuli are being carried to the higher centers of the brain for integration. So right now, I'd be summarizing and giving you a little insight into how different informations are being carried through the different aspects of the spinal cord. So when we get into the complete discussion over here, we must know that we have these evolved kind of stimuli. For instance, the pressure sensations. So if it is a light pressure or if it is the maximum amounts of pressure, it is basically stimulated by that particular individual and is appreciated by that individual through these tracts which are present dorsally in the spinal cord. So as I've already mentioned, we have these two main tracts, particularly the fasciculus gracilis and the fasciculus cuneatus, that are present at the dorsal columns of the spinal cord. They are ascending tracts and they are carrying information such as pressure and then the vibration. The vibratory sensations are also carried through these same tracts. Then we have the different movements, the joint movements that are taking place. They're even sensed and the messages are taken up regarding the posture of an individual, regarding the different movements that are taking place at that particular joint, and then an overall positioning. So even when you close your eyes, you can sense that what is the particular position of your limb. How do you sense that? That is basically sensed through these particular tracts in your dorsal columns, and they are taking these informations. And we now know that the dorsal columns have the fasciculus gracilis and the fasciculus cuneatus. So this is what you have to remember for right now. And then obviously touch, but it is not going to be a crude touch. Crude touch and fine touch, they are two different separate entities. Crude touch, basically when we touch an object and we know that we have touched this particular object. But when you touch an object and you know that either it is a smooth object or either it is a rough surface that you are touching, then this is how you're basically discriminating between two objects. You can even identify a lot of objects by touching different objects. And whenever there is something wrong with this particular tract that is taking up this information of discriminative touch, and you ask that individual and you just make him hold, for instance, any common object, for instance, a key, and you ask him to identify the object by just touching that particular object, and he's unable to do it due to this particular lesion that is present in the dorsal column and is involving the fasciculus gracilis and cuneatus, or either cuneatus, and this information is being lost over there, he or she is going to be unable to identify objects just by touching them. This condition is known as anaxonosmia, and it's basically the inability to identify objects by touching them, by recognizing the shape through touching them. So this is basically the discriminative touch, which is quite different and is something which evolves with the passage of time in human beings. So then we have the lateral columns, and they are taking informations which are basically primitive in their nature. Even when a child is born, he's young enough, the reflexes are not evolved at that particular time, the child can still sense the hot and the cold objects. He still responds to any painful stimuli. So these are basically the primitive kind of reflexes that are present even at birth. And even the child responds to touch, and then we have the pressure. So these are basically the alignment for the primitive reflexes. Mainly we have touch, we have temperature, we have pain, and then we have the pressure sensations that an individual feels right at birth. So this is how the informations, the different kind of information, and that even evolves with the passage of time. The person collects the different integrative messages from the surroundings, and he or she knows how to integrate these messages with the help of these ascending tracts. So the information regarding the temperature, pain, touch, and pressure, they are carried by the anterior and the lateral spinothalamic tracts for the higher integrations in the final centers of the brain.